This week on tech-byte, we're at the Vascular Institute of Chattanooga with my friend Dr. Lasar. He is going to help us shed some light on an often overlooked and misdiagnosed problem that millions of Americans have. I'm Patrick Moats.
And I'm Dr. Lasar, and welcome to this week's tech-byte.
Tech-byte, sponsored by Epicos Comics and Games and Verizon.
This week's tech-byte is about a condition you may or may not have heard of called May-Thurner Syndrome. Dr. Lasar, thank you for having us. What is May-Thurner Syndrome?
Patrick, happy to be here. May-Thurner Syndrome is a condition where a vein is pinched or compressed inside the abdomen. And the way the body works is blood flows from the heart in the artery to your toes. The veins take the blood back. If the vein is pinched, patients will have chronic swelling, or they'll complain of pain, pressure, heaviness, achiness in their legs, and often goes undiagnosed if we don't chase after this and try to figure this out.
Okay, so how would I know, because you say it affects men and women, you've seen patients from 19 up to 96?
96.
So it could affect anybody, men or women. How do I know if it's just a pulled muscle? How do I know the difference?
Well, I think the important thing is having leg pain is not normal. So if you have pressure or pain or heaviness, achiness in the leg that's unexplained, you need to see your doctor. You need to see your primary doctor, and they will try to figure out if this is a vein problem or vein disease. If they do think that it is, they'll refer to a vascular place like this, where we can do the ultrasounds to actually diagnose the problem and then give patients the options of what to do in that situation.
Okay, now in some cases you said you could just treat it with normal exercise, simple treatments, but you said others that might be more severe, you're gonna have to use stents.
Yeah.
And these are the Venovo stents you use.
Yeah.
These do not look small, so
No,
this seems
not.
to be an invasive.
Yeah, it is a minimally invasive procedure, okay, and we do that through a small needle. They don't go in this big. They're actually very small, like the size of a pencil.
Okay.
You can slide them into the vein and actually deploy the stent inside the vein in patients that have severe problems. Now, this is someone that has a pain out of 8 or 9 out of 10 on a daily basis, or they have severe swelling in the lower extremities. Someone that has a severe condition, we can actually use the stents to fix that problem. Other patients that are having mild symptoms, we can talk about moving and walking, and you can't stand for long periods or sit for long periods if you have that condition. So there's other ways to manage it other than just a stent.
What's the downtime? What's the procedure time? I know most of the stuff you do is minimally invasive, and this is minimally invasive as well.
Yeah, that's usually about a 3-hour period of time. So hour to kind of get ready in our outpatient surgery center, hour for the procedure, a little bit less than that technical time, and then about an hour to recover.
So if you have questions for Dr. Lasar, you can reach them at the Vascular Institute of Chattanooga. If you have questions about today's episode, or you'd like to see us feature your idea, please shoot me an email. I'm Patrick Moats. Dr. Lasar, thank you for coming. Thank you for having us.
Absolutely.
Thank you for watching tech-byte.
Tech-byte, sponsored by Epicos Comics and Games and Verizon.